Welcome, everyone, to the first HealthLinks webinar of 2026. It's so nice to see everybody coming into the Zoom virtual space. For those of you that know our sequence here, if you want to put in chat where you're coming from, we love seeing all the states and countries and individuals as you're logging in. It's great to see names and states represented from all over the US and so many countries internationally. Today's conversation is really an important one as we kick off 2026 and a topic that we've been working on for a decade plus, which is supporting families in the workplace. And we use a pretty broad definition of family. So thank you for being here today. Good to see so many people logging in. We're glad to have you for this first webinar of 2026. My name is David Shapiro. I use he, him pronouns, and I am a white man in my late 40s. I can still say that for a few more months. I have dark brown curly hair, a clean shaven face, and gray glasses today. I'm joining you from my home office in Denver, Colorado, and it's a bright sunny day here. So I hope it's sunny and nice wherever you are. I know if you're coming in from New England, maybe you're still shoveling yourselves out. So again, thanks for being here to talk about supporting families and their work experience. Just a few housekeeping items before we get started. All participants in the webinar are on mute, and you can use the chat function for any technical assistance you may need. So that would be sound or video capabilities. If you have questions, though, for any of the presenters and speakers today, please use the the Q&A section, rather, of the Zoom toolbar. That way, your friends and colleagues can put a thumbs up on your question and don't have to type the same thing. We never have a chance to get to all the Q&A, but we'll do our best to get to as many of them as possible. If you need closed captioning, that is available through your Zoom toolbar. And also, we do provide continuing education credits through a variety of platforms. A little bit of a change in 2026. You'll be able to claim those credits upon giving us back the survey, and the survey is going to come in the follow-up email. The survey will not be auto-populated when you leave today's webinar. So stay tuned for an email from us, and you'll get the survey to redeem and claim your continuing education credits, which we know is so important to all of you. And lastly, the webinar is being recorded today, and so you'll have a chance to review the recording and share it with your colleagues at a later date as well. All of that information will be coming in the follow-up email. A little bit about our program. HealthLinks is a public health practice program located at the Centers for Health, Work, and Environment. We're on the University of Colorado Anschutz Medical Campus in Aurora, Colorado. And we get to talk to businesses of every shape and size in every industry about commitment to total worker health, workplace health and safety. And family friendly is such an important component of the total worker health conversation. And we do that through assessment, advising, action planning, and working strategically with companies directly one-on-one. If you want any additional information about HealthLinks, our website and our information will be available to you not only through this webinar, but also in the follow-up emails. We always start these webinars with a land acknowledgement from the University of Colorado. I'll read that now. As we gather, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of indigenous peoples recognizes the original stewards of these lands and their legacies. And with this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems indigenous peoples have developed in relationship to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many indigenous people who thrive in this place, alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse indigenous peoples still connected to this land. We honor them and thank the indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native people. Just a quick disclaimer here, the views that are presented in today's webinar are those of myself and the speakers. They do not represent the views and opinions of the University of Colorado, nor one of our funders, the Centers for Disease Control and Prevention, the CDC. And so, if you need to engage with this webinar in any way that you see fit, please do so. And if you need follow-up information after anything that went on today, please reach out to us via email. So, the agenda for today, we're going to have a discussion with esteemed colleagues and panelists, and then we're going to open things up for a question and answer. I'll do a little bit of an intro since we've been working on family friendly for such a long time on the HealthLink's commitment to family friendly as well. That'll lead us off today. And our objectives for today are really to help you identify key challenges facing parents and caregivers in the workplace specifically, and applying some guidance from a resource that is soon forthcoming, an updated version of our family-friendly workplace toolkit. And it's specifically relevant to small businesses, entrepreneurs, and historically overlooked workers. And our hope is that you feel comfortable starting to build an actionable family-friendly workplace plan for your organization if you don't have one, or enhance your current plan with some of the things you hear and learn today. So let me start by giving you just a little bit of explanation of what we mean when we talk about family-friendly workplaces. This is a topic that I've been working on since 2016. It's hard to believe it's been over 10 years of working on family-friendly workplace stuff, and in partnership with state partners that we're going to introduce today. We started our exploration of family-friendly with a definition. I think it's important to ground us in what we're talking about here, and that's a family-friendly workplace is supports all individuals in every stage of life, which can be a long stage of life in our current work environment. And the goal is having people thrive at work, at home, and in the community. So if you think about this broad example, it could include things like volunteer opportunities, elder care, and caring for young children. And it includes what a home environment looks like in terms of support, a work environment, and also what things look like out in the community. So important to think about this broad definition. And the reason we're talking about it, and our colleagues and friends from the Department of Public Health and Environment and Department of Labor will expand on this in just a moment. But families look different today than they did a few generations ago, right? Over 50 years ago, more than half of U.S. children were growing up with married parents, a father who worked full time, and a mother who was not necessarily in the workforce. And today, less than 1 in 5 children grow up in such a family. And it's broader than just children, too. We're caring for more individuals than we ever have before, different types of individuals and different types of families. So we now have, over 300,000 children under age 6, where all available parents are in the workforce, and a lot of people who are employed outside the home. We also have more same gender and same sex couples than ever before, and the number of families now with a stay-at-home father and a working mother has also doubled. So families just look different than they did 50 years ago. And so, what does family-friendly workplace mean in the modern workplace? Is what we're hoping to describe to you today and help you better understand. The term work-life balance is pretty ubiquitous out there in the literature. It's bigger than balance. It's about integrating life and work into one holistic system that you feel like you're thriving, again, at work, at home, and in the community. So it's bigger than balance and finding balance. It's a really important concept, and it's something that I want you to think about and consider your own experience as we get through this. And I think this is a good time to launch a poll for all of you on the webinar. Our poll for today is about familiarity. And specifically, the question is, how familiar are you with family-friendly policies in your workplace? We're going to describe them in just a minute, but before we do that, I don't want to give you the keys to that quiz. But from a scale of not familiar to very familiar, why don't you give us an idea of how familiar you are with the family-friendly policies in your own workplace? So we'll give you just a little moment here to fill that out. Great. We're starting to see the answers slow down a little bit, but we appreciate you giving us your thoughts and feedback. We have over 70% of you filling out the survey. And so 40% of you said you're a little bit familiar with the policies in your workplace, 11% neutral, 17% not familiar at all. And when we combine familiar and very familiar, we're at 32% total, 27% familiar, 5% very familiar. So we have an opportunity here for everybody to learn more, to think maybe more broadly about what family-friendly policies are and mean. Perhaps you go back and look a little bit more into what policies your organization has and how they're connected to family-friendly, and maybe even you advocate at the workplace level for additional policies or support. So when we talk about what is a family-friendly workplace, what it looks like in practice, we have to start with what types of benefits and paid time off individuals have access to, right? Health insurance plan, medical plans, paid leave, including paid family leave, things like EAPs or employee assistance programs, what type of insurance programs, short-term and long-term disability, and also tax leveraged accounts, dependent care spending accounts, flexible spending accounts, health savings accounts. These are all parts of being a family-friendly workplace. And then a really important one, and one in fact we define in its own category on the next slide, is how caregivers feel support in the workplace. And this looks different at a restaurant where there's shift workers or a hospital where there's nurses and doctors versus an office where people have a little bit more flexibility of when they come and go. But individuals can still feel supported. They can feel like they belong and are included in the workplace. And we're going to talk about some of those strategies and hear from an employer in just a moment that's really focused on supporting caregivers in the workplace. When we talk about specifically supporting caregivers, it's really important to think about things like lactation accommodations, how self-care is being focused on, sleep and stress management, financial planning like 529 savings accounts for higher education, and dependent care savings accounts come into this category as well. And then are there groups and support groups for new parents in the workplace? That's another strategy that a lot of companies will deploy in terms of supporting specific groups of employees. So how you're supporting caregivers is a big component. We've said for the last decade that flexibility is probably the most important family-friendly benefit that your organization can offer because you can have the best insurance program and the best policies and practices in place. But if people aren't able to access it through flexible work arrangements, through flexible scheduling, well, then perhaps it's not being utilized in the way that the company intended. And flexibility looks like a lot of different options. It includes job sharing, where multiple people are trained on a job. It sometimes includes compressed work week or telework, gradual returns to work after a leave for caregiving, and maybe perhaps being able to leave on short notice for emergencies or unexpected times off. Also, are caregivers supported in terms of having flexible arrangements for the things that caregivers need to go and take care of? And then lastly, how are you communicating, educating, and training your team members about the policies, practices, and programs you have? So without even doing an analysis of what your company has, it's good to know, are we communicating well to team members? Are we training them on what our paid sick leave policy is if we have one? Are people getting education and training on how to access lactation accommodation rooms or lactation accommodation benefits if we have it? If people are focused on elder care or pet care, how are we working to make sure that our team members understand that this is a company that's committed to supporting those individuals? And we'll talk about some of those strategies during our Q&A session as well. So if you have questions on any of this, it's a good time to start thinking about what you might want to put in the Q&A for our speakers. I'll mention that we have a resource that's already been published. This is a snapshot from the one that currently exists, the Family Friendly Workplace Toolkit. It is a partnership between us, the Colorado Department of Public Health and Environment, and a nonprofit, EPIC, Executives Partnering to Invest in Children. And coming soon is an updated version of this toolkit. We're really excited to launch version 2.0, and we'll make sure that everybody that's participating on this webinar, as soon as this toolkit is ready, gets a direct link to this toolkit so you can access it and learn more about what we're talking about. So with that, I'm going to introduce our other speakers today. Thanks for providing me with the space to introduce this conversation a bit. First up, we have Reed Bryan, who is a master's level public health professional specializing in maternal and child health. Reed has been with the Colorado Department of Public Health and Environment, or CDPHE, for 10 years and manages maternal child health funding to local public health agencies. Reed also serves on the Total Worker Health Family Friendly Subcommittee, awesome, at the department, and she leads the New Parent Connections Program, which is a peer-led support program for new parents to connect and share resources. Reed, you've been such a great partner in this work in the several years we've gotten to know one another, so thanks for being here. I'm going to pull your slide back up and turn it over to you.
Thanks, David, for that introduction. Good morning, everyone, or whatever time it is where you are. It's a very diverse audience on the call today. I saw some folks from Oregon. I'm originally an Oregonian, so that warms my heart. As I was introduced, my name is Reed Bryan, she, hers. I'm with the Colorado Department of Public Health and Environment. And I was part of convening the work group to update the Family Friendly Toolkit 2.0, which David mentioned, and also on that Total Worker Family Friendly subcommittee here at my organization. So you might be wondering, why is a public health professional on a call about family-friendly workplaces? What is the role of public health in this work? And some of you might have guessed, I plan to talk about the link between family-friendly practices and the resulting impacts on health outcomes. The Family Friendly Toolkit 2.0 itself will be that practical tool that gives you those strategies, the case studies, and examples of how employers and businesses might go about making their workplace more family friendly. But my job is to start with, why is it important? But before we dive into that, I'd love to give a nod to the role that public health is in being the convener of experts, of bringing people together that are thinking about this work, care about this work, are doing this work. So a shout out to HealthLinks, the university, Colorado Department of Labor and Employment, the health department. We support and fund this work because we understand the importance of mobilizing community education and buy-in around family-friendly policies as a key lever for healthy and thriving families and communities. So next slide, let's talk about the intersection of family-friendly workplaces and public health, thanks to AI for the images in my next slide here, depicting workplace scenarios where employees are getting family-friendly support. Where you work impacts your health. Many of you might know public health is a population approach to health. So how can we make our society healthier overall by shaping systems that make the healthy choice, the easy choice, that just support health overall? To this end, public health explores the root causes of health and well-being and looks at practices, policies, and environments that support the conditions where people can thrive. So it's not surprising, the workplace is a huge part of where people spend their time and greatly influence their lives and therefore their health. We know 80 to 90% of health outcomes are determined by social, environmental, and behavioral factors, only 10 to 20% really connected to that clinical or medical care access. So the family-friendly toolkit, and as David already mentioned, takes a really broad definition of family-friendly, but just to reiterate, family is the unit in our lives where we provide and receive support, both financial and emotional, and it can cover a broad spectrum of relationships. So being family-friendly simply means that an employer supports practices that seek a balance, or as David said, an integration between our work and our personal life, and honors the needs of employees as people and people who are often responsible for others. So family-friendly workplaces have some very obvious links to health outcomes and some more tangential or less talked about impacts. It goes without saying that good sick leave, flexible schedules, access to healthcare can help sick employees stay home and reduce the spread of illness. Strategies detailed in the toolkit, like direct primary care and gap coverage, can help employees access preventative care to prevent, diagnose, and treat chronic illness. But thinking more holistically, family-friendly practices, policies, and environments, they strengthen families' ability to balance or integrate work and family obligations, and they reduce stress, stabilize finances, contribute to food security, support mental health, and improve levels of satisfaction at work and overall. So all of these outcomes have a ripple effect. Think that stone in the pond, improving or that ripple effect for those employees and those family members that they support, and the potential indirect effects linking to a lowered risk for substance use, for example, a lower risk for poor mental health, including suicide, which is one of our state's state public health priorities. So yes, lactation-friendly policy in a lactation room, that is public health. Tuition assistance, an advance on a paycheck, emergency childcare options, connecting families to tax credits, that is all public health. The ability to swap a shift, support career development through job shadowing or mentorship, even snacks in the break room, something that simple, all of these things are public health. I will take one specific example just because the evidence is so well documented, but I know we have a diverse audience here today from different states and different parts of the world. So I acknowledge you might not be in a place that offers this, but there is really a well-documented evidence about paid leave policies. These can reduce the risk of maternal depression, improve vaccination rates, increase breastfeeding, and support women returning to the workforce in particular, which leads to increased economic stability overall. There's even evidence that these policies are associated with lower infant and maternal mortality. And paid leave isn't just for parents either. The data in Colorado actually shows people are accessing it the most for medical leave for their own personal health. And it's also available for another really crucial and less talked about reason, which is safe leave for domestic violence. So workers can take job protected paid leave off to address safety needs and seek help without risking their jobs or outcomes. So that's a major barrier to leaving abusive partners if they don't have that job security or economic stability. It's worth mentioning because I work in maternal child health. One of our public health priorities is strengthening systems that support children and youth with special healthcare needs, and that families with children with these special healthcare needs disproportionately drop out of the workforce because of the demands of caregiving. And these family-friendly practices can go a long way in allowing these caregivers to stay in the workforce and stabilizing these vulnerable families. We also know that healthy child development means creating safe, stable, nurturing relationships, environments. If the workplace can support parents to this end through family-friendly practices, flexible schedule, healthcare access, financial wellness, retirement, childcare, other strategies, it can indirectly influence a plethora of positive health outcomes, build family resiliency and stability. And I think Bobby's going to be talking about quality employment, so I won't go there, but there's some pretty strong evidence about that link to poor child mental health and school performance when there's low job quality. And many of these family-friendly strategies are tax advantaged for businesses. They have a strong return on investment, or they're low cost. And the result is reduced job turnover, retained talent. It's good for businesses and workers. Finally, these policies can also help increase labor force participation across the board, assist with economic mobility, career advancement, a workplace that is welcoming and supportive of people with many different backgrounds and experiences, which we know leads to improved productivity and innovation. And this has just a really profound impact, especially on low-income families, single parents, women. Ultimately, from a public health perspective, it's important to understand who has access and who does not have access to these family-friendly supports, policies, environments. And if you look to support those who have the least amount of access, the least amount of supports, you will benefit the community as a whole. The toolkit intentionally offers a really broad set of strategies with different leverage points, acknowledging that there's no one policy that's going to be a panacea. It's also not all or nothing. I know businesses are strapped sometimes, but you can start small, do what you can, and it does make a difference. Just connecting workers to the benefits that are already available can be a huge help. It is February, right? So it is tax season. And we have some really strong evidence and work at CDPHE around connecting family with child tax credits and how that has an impact on child poverty. So just connecting those families with benefits they might not be aware of. To close, just a really quick story from Colorado. 8 or 9 years ago, people told us creating paid leave for families would never happen. And then COVID hit. And it gave us a new understanding of why things like paid leave and childcare, sick leave, healthcare, all of these things are important for healthcare workers. People are sick, vulnerable. They realized it's best for, folks realized it's best for society, and we passed it. So we can create new norms around how we support families. More recent exciting examples can be found in New Mexico and New York, advancing towards universal childcare policies too. So to close, I just wanted to give thanks to the folks that helped update the toolkit. We had folks join us from Good Business Colorado. GBC helped recruit a bunch of case studies, so you'll hear from actual businesses in that toolkit of what they did and how they did it. Colorado Workforce Development Council, Executives Partnering to Invest in Children, Colorado Department of Early Childhood, Health Links, business owners, Prosper Bridge, Dope Mom Life, Spur, and Gabriella Stapleton Consultants. So check out those case studies. Thanks to those businesses for sharing their experiences, and a big thanks to Health Links for hosting this work ongoing. Thank you very much.
Thanks so much, Reed. Great comprehensive overview. You're right that family-friendly workplaces is good for business, and it's certainly good for families and public health as well. We've been talking about that for ages, and the amount of trust and loyalty it builds in the brand is really important. And we're going to hear from a company that's implementing family-friendly practices soon. And again, if you have any questions based on Reed's comments or Bobby coming up or things that come to mind, please put them in the Q&A section of Zoom. Perhaps your friends and colleagues on the webinar have the same questions. You can use the thumbs up to vote on the questions that show up there. With that, I'm going to introduce our next speaker for today, who is Bobby Wolf. Bobby is the Senior Consultant for Sector Partnerships and Industry for the Colorado Workforce Development Council office. In this role, Bobby is responsible for implementing the guidance of the sector's steering committee and ensuring that deep and meaningful industry engagement is occurring through regional sector partnerships and industry-led talent development efforts across Colorado. She joined the CWDC office in 2019 and has worked on stimulus funding for regional sector staffing, alongside trade associations implementing innovative workforce training and project managing the Lives Empowered initiative. Bobby's passionate about listening to the needs of Colorado communities and testing solutions collaboratively. Bobby graduated from Colorado State University with a degree in industrial organizational psychology, and she can be found running around local trail systems, snowboarding, and exploring Colorado's many local breweries. Bobby, it's really great to have you here today. It's great to have representation from both the Department of Public Health and the Department of Labor and Employment. It shows just how impactful and important family-friendly is. So please talk to us a little bit about why family-friendly workplace is relevant to you and your job, to labor and workforce development. I'll turn the stage over to you. Thanks for being here.
Thanks, David. I am so thrilled to be here with all of you today. In a personal capacity, having workplaces that are able to be flexible during times of grief or uncertainty has always been incredibly impactful for me in my career. And it's one of the many reasons why I feel so passionate about being able to join you all today to talk about family-friendly workplaces and also the intersection for how that is part of workforce development. As David mentioned, I'm with the Colorado Workforce Development Council. This is a governor-appointed public-private partnership with the purpose to advise, oversee, and integrate the work of the Colorado Talent Development Network. Our vision is that every employer has access to a skilled workforce, and every Coloradan has the opportunity for meaningful employment, resulting in individual and statewide prosperity. CWC's mission is to enhance and sustain a skills-based talent development network that meets the needs of employers, workers, job seekers, and learners for today and tomorrow. We know in a rapidly changing economy characterized by globalization, advances in technology, and automation, employers are struggling to attract and retain the skilled workforce they need to grow. A family-friendly workplace is imperative for retention and attraction of talent. Having a full-time job no longer provides the economic security it once did, as too often when jobs fail to include basic job quality features, it leads to a cycle of instability among workers that will result in high turnover and declining productivity and exacerbate labor shortages for businesses. You might be unfamiliar with the term quality job or job quality. When I'm talking about quality jobs, we really believe that this happens on a continuum. And when I'm referring to this, I'm referring to features of a job that can improve the experience for an individual, as well as the overall culture of a workplace. Quality jobs have been shown to better attract talented workers, reduce turnover cost, and increase employee engagement and productivity while improving a company's operations and profitability. The features that we see making up a quality job include wages, benefits that facilitate a healthy, stable life, a schedule that enables workers to balance other demands of life, what we've been talking about here today together, working conditions that promote physical, emotional, and psychological safety and wellness, transparent growth opportunities for advancement, and a sense of belonging in an inclusive environment where individuals are accepted and connected to one another. Based on recent data, in each year in Colorado here, the CWC releases a talent pipeline report, which we just released this last December. This recent data from our talent pipeline report, our Colorado's job openings per unemployed person is below 1. Back in 2023, we were seeing this number around 1.5. So we're seeing and we're feeling a tightening of the market between jobs and workers. And we also know we have one of the fastest growing aging populations in the country. Without support to workers who may find themselves in what is known as the sandwich generation, where they are taking care of aging parents, themselves, and their children, a deep cycle of instability can unfortunately become normalized, leading to burnout with absenteeism or presenteeism, where they're still showing up but not truly interacting with the work, and ultimately turnover, costing the business. And also the individual having to then go back out into seeking for a new employment. When we really think about it on both an individual and ecosystem level, family friendly workplaces contribute to a healthier, more sustainable workforce in the community. By creating a culture and taking steps to support employees' well being, businesses are even able to double down as a workplace that individuals seek to join. And I know we have a really great business partner on here who's going to share more about what they are doing. I do want to be able to share and just take a second about a coalition of employers in Northern Colorado. I saw in the chat some folks saying that they're from Colorado. I saw a shout out to Fort Collins. I hope that you're aware of this group. If not, would love to get connected. That this group of healthcare employers in Northern Colorado, the last 3 years, they've been putting on a nurse well-being conference. I've often heard from the healthcare industry that they can struggle significantly with being able to implement flexible schedules, particularly in rural areas where they do want to be able to leverage that, particularly to attract retirees and parents into their workforce. The Northern Colorado Healthcare Sector Partnership came together to understand how can we take a moment to pause and really celebrate and help to recharge our nurses and give them some tools to be able to understand how to navigate this work-life integration that we've been talking about here. The conference has been a huge hit. It's been going on for 3 years. It even had the opportunity and was a finalist for a national Best of Nursing award just this last year or so. They uplift these promising practices to help support balance and spend a full day investing in the individual. It's really just truly a beautiful effort. And I've loved seeing how the employers have come together to see different types of baby steps they can do to recognize ways to help reduce stress for the individual worker while also being able to be a business successfully contributing back to the community. And with that, David, I will turn it back over to you so I'm very excited to hear from Daniel as well.
Thanks so much, Bobby. It's really important to hear the workforce development side of things, the labor side of things. I see some terrific questions coming into Q&A as well. Remember, that's your opportunity to ask questions for our panel today. We'll try to get to as many of them as possible. I do see some questions coming in around data and research, and we probably don't have some of those statistics right off the top of our at our fingertips right now, but we can certainly follow up, and they are available, some of the data and research requests in our toolkit as well. And so we will get on some of those questions that came in. We've captured them. With that, I'm going to introduce our third speaker for today, Daniel Rector. Daniel is the Director of Health, Safety, and Environment at RK Industries. His foundation in compliance began in the U.S. Coast Guard, where he served as a marine science technician, overseeing regulatory safety and security compliance of federal trade zones. Dan followed this with experience in the Department of Transportation and the transportation industry before moving into his current leadership role in construction and EHS management. Dan, it's great to have you here today. Please tell us a little bit about RK and what being a family-friendly workplace looks like at RK, if you don't mind. We appreciate the context you're going to provide us today.
Yeah, absolutely. First of all, thank you for having me. RK, right now, we are a diversified construction, manufacturing, and service company. We specialize in heavy commercial and industrial construction. We operate 8 manufacturing facilities in 6 different states currently. We employ about 1,700 team members. Just last year, we onboarded 850 new employees, and we will be projected to double in the next 8 years. Um, so a lot of growth in multiple sectors. We're primarily in 6 states, but we do work in about 20 states around the nation, and we have done international work as well. So family-friendly work practices, you know what? I got to start with, I didn't know what this was when I first started at RK. I've been here for about 8 years. Um, a lot of this stuff I think companies take for granted. I took for granted, and thinking that this was just kind of standard. I'm not going to get into our entire benefits guide. That's what we give to prospective employees um, and people at new hire orientation. But we offer flexible PTO that is not just accrued, uh, but that is banked as well year over year. So it's not a use it or lose it PTO policy for paid time off. Uh, the biggest thing is we don't ask why people are taking time off, right? Whether it's illness, caregiving, family needs, or anything like that. Um, if the employee has earned that time off, they should be able to take it for what they need. And that's just kind of a general mentality around the company. And then we do have a separate leaves department. So they specialize, whether that's short-term disability, long-term disability. In Colorado, we have Family Medical Leave Act or anything like that. They specialize in those leaves. They specialize in educating our employees, which starts day one at new hire orientation. So there's about an hour-long benefits training session where we go through all new employees and we say, hey, these are the benefits that we offer. This is what it means. This is how you access them. And then in every October during our renewal phase, we host multiple different benefit seminars. So we'll send this benefits department around to all of our regions, and it is open to employees and dependents to come discuss their personal benefits and what fits their family needs the best. So that's something that's been huge. We offer $100 monthly wellness discount for families that are participating in annual wellness exams for preventative care. And last year, what we started is we are bringing in healthcare professionals to our facilities and offering these annual exams that apply to this $100 discount for our employees and dependents so they can make appointments. I know right now, especially finding primary care scheduling appointments can be difficult. And we said, hey, at least we can provide an alternative service and bring healthcare to our employees, make it a little bit easier for them so they can do full blood screens and annual wellness exams. We have a 401k plan, our retirement plan. It starts 6 months after employment. And for the first 3% contribution, we do a 100% match. For the second 2%, we do a 50% match. And the match is as soon as they're eligible to start in the 401k, we immediately start matching. There's a lot of other benefits, medical, dental, everything is offered to dependents. Workplace flexibility. So we have remote work and we have designated policies for eligible roles in at least our industries in construction and manufacturing, especially our tradespeople either in the field or on the floor. It is difficult to accommodate remote work, but we do have eligibility requirements based on what people can do. I have some examples later on as we'll talk about that. And then we do have RK University. RK University is our internal training system. We do train our managers on what our policies are, how to have conversations about people going on leave, and what resources they have at their disposal. And then we have, the American with Disabilities Act. We have our accommodation policies for anyone who is under either medical restrictions or any kind of disability that they may need flexibility in their work schedule or work environment. So we do consult with a lot of our insurance brokers and insurance providers. If your companies are working with insurance companies and paying them lots of money every year in premiums, lean on them to provide consultants, typically included in your premiums, to provide you with, ergonomic workplace setups or how to approach accommodation policies in your workplace. So that makes it very easy. We have a lot of external resources that help us along the way, give us guidance, and that we can lean on. And then getting into kind of the caregiving and crisis support. So we do have an employee assistance program that is available to every employee and their dependents. And that's immediate on day one. They're eligible for that. So not only do we tell them it's in their benefits guide, we talk about it in our new hire orientation. We also have a mental health toolkit, which explains all the services that this employee assistance program can offer. And we mail that to employees' homes. That way, we said, hey, if we give the employee, a QR code or anything like that, it may not reach some of the dependents. So if we mail it to the home of the residents, hopefully it'll reach some more people. So we had over 120 employees or dependents last year use these services. Counseling and therapy are the most utilized, but it also involves financial resources, legal resources, last will and testament. So yeah, one of my favorite programs that we've been able to enact, and it took a couple years. A lot of these things, when you talk about family-friendly policies, procedures, they're going to take time, they're going to take investment. One of my favorites is the RK Hero Fund, and it is a primarily employee-funded hardship program. So upon orientation, you're any time throughout the year, you're allowed to start contributing to the Hero Fund. It starts at $5 per week. Last year, we had $120,000 contributed to this fund. 44 employees received direct financial assistance. So you apply for a grant through this program, and a committee reviews your application, and then it's grant money given to that employee through any kind of hardship. Again, circumstances vary wildly as to why people apply. That's not the point. The point is, employees get to help each other out. We hold fundraising events throughout the year. And then we have the RK Foundation is our charitable organization. The foundation, along with our owners, personally match all of our fundraising amounts. We have little things like Thanksgiving baskets and giving tree incentives during the holiday season. Employees that are in need, we try to help each other out. I'm trying to think of a lot of the other things. What I really want to get into, career growth and stability. This is the thing for employers. This is why, I don't want to say compassion is not the ultimate goal here. But for employers in particular, why would you want to implement family-friendly work practices? Is stability. And it's been talked about already here. Retention is a huge factor in a lot of our businesses. I know in the trades, it's massive. For us, what we did is fully paid for apprenticeship programs where we offer laptops to all of our apprentices, new boots, tools. We offer tuition reimbursement, trade-specific leadership tracks. And then I think we have over 6,000 combined hours of leadership training last year alone amongst our employees. I want to give you one of my favorite examples, a specific example about one of our employees. So this happened last year. We have a roving safety professional. This professional typically oversees 10 to 15 different commercial construction job sites, uh, managing safety on site, coordinating with our operations teams. Um, and they became pregnant. And so when we learned about their pregnancy and we learned about what the timeline was going to be, thankfully they gave us plenty of advance notice. We were able to plan out the next 7 months of job site coverage and gradually change what that coverage looked like to limit travel distance from home, potential severity of hazard exposure on construction sites. Um, so, and this was all at, their with their input. Communication is one of the biggest keys here. If you want to know how to, not how, but what family-friendly policies to implement, listen to the employees. Listen to what their needs are. Give them the opportunity to speak out. So with this particular employee, we transitioned them into an office-based support role as their due date grew closer. It's funny, while they were doing this, they were using our tuition assistance program. And they're finishing, I think, this May, their bachelor's in occupational health and safety, which has been completely covered by the company, their entire degree. They went on their 3-month leave. And as they came back, and before they went on leave, we discussed a gradual introduction back into the workplace, right? So kind of the inverse of what we did at the end, started with office work, gradually transitioned them back out to the field. A lot of these flexibility schedules, flexibility in work tasking and things like that are difficult, especially when you're under a time crunch. Biggest thing is talk to your employees and let them know, hey, if something is coming up, yes, there are emergencies, yes, there are last minute things. Give as much advance notice as possible and be able to pivot, right? Because this is even in the construction field, we can pivot some, right? One of our biggest goals when we look at new projects, we look at new manufacturing facilities, is where does our population live in relation to where we are looking at real estate, right? Even just proximity and commute can have a huge impact on how employees view the employer. So that's another easy way to take care of that.
Dan, we're going to switch over to Q&A. Thank you so much for that. I think you'll probably get a lot of resumes flooding the RK inbox. You all are doing so many of the things we talked about. I'm going to ask our other speakers to rejoin us for the panel discussion, if you're able, as you're able now. And I just want to mention there's a couple things that you indicated that are really simple solutions that a lot of companies don't think about, right? Mailing EAP or mental health benefit packages to homes so that partners, spouses, dependents can also see and access those benefits in a site where, people get paperwork, it may get lost, they may forget to bring it home, etc. Really critical and pretty easy thing for companies to do. Oftentimes the vendor themselves is willing to send that paperwork and package direct to homes because they know that people utilize the services more. It's a win-win-win situation. And then just in general, educating managers and supervisors on what the benefits are, how to have the conversation. Again, communication, like you said, Dan, is so key to this. And so I just really appreciate the perspective that you brought to today's conversation, the real life practical aspect to it. So let's start with maybe a bit. We'll start with a question with the most votes right now. How can someone advocate for family-friendly policies in the workplace, specifically if they're not in an HR related role? Dan, maybe I'll start with you. You're in a company, and let's say you have a team member who wants to advocate for something new. Maybe it's pet care insurance. Perhaps you already offer that, or maybe it's something having to do with elder care or a new support group for people dealing with aging adults, right? Some of these things are newer in the workplace. What would you recommend for a team member on how they could maybe advance a concept to a business? And let's maybe take the hat off that this is RK and it's so supportive of everyone, and think a little bit more outside the box on some ideas and thoughts for folks. And maybe Dan, after you, we'll see if Bobby has any comments on that too. So Dan, what do you think about advocating for increased family-friendly policies or new ones in the workplace?
Yeah. So, I mean, RK, even with the head off, RK is not much different than most other companies. Um, there is a bottom line. The biggest thing I would say is research. First, research. If an employee comes up, they have an idea for a policy or a procedure, um, research the return on investment, create a request for a proposal for that particular thing. Look at the dollars. That is going to be a huge thing, but recognize um, in a lot of companies will look at direct impact. Dollars, especially when you turn on return on investment, you're looking at direct dollars out versus direct dollars in. Really focus on indirect cost savings, right? If you look at retention and to rehire an employee at RK, I think the minimum is $15,000 just to find a new person and get them trained. And it goes up from there. Or I can spend, and if our retention is, or if we have bad retention, or I can spend, 60 grand on a new policy, keep more people based on this data. Therefore, I'm actually saving the company money in the long term. So speaking the language of the higher up, speaking the language of the executives, that's the easiest way to get some of this stuff across.
Thanks, Dan. I really appreciate that. Before I turn it over to Bobby and Reed for some comments on this too, um, so many times when we talked about paid family leave, and we were able to pass the Family Act in Colorado, but I had been working on this well before the Family Act came about. The hesitation from companies is this is going to be too expensive for us to implement, and the response was, "I understand that fear. Can you help? Can we run some numbers together just to see what the actual cost might be?" And it turned out that statement was not often backed by real practical real life data. It was a myth. It was something that was a talking point. And when companies ran the data on who was actually leaving for paid family leave, whether it be for FMLA for their own care or for a family, the number was quite a bit smaller than they anticipated. And that really shifted the conversation. Just asking the question of let's dig into the research, like you're saying, let's get some real data before we make an assessment either way. So, how do we approach some of these new ideas with curiosity? And for those of you that want to advance a new concept, seeing what the reaction is and being curious yourself is oftentimes a really important strategy. Bobby, do you have anything you want to add from a labor workers perspective on how to advocate for additional supports in the workplace?
My comments are more towards the business side than on the individual side, but it's
Great.
really around ensuring that you do have that culture where your employees are able to come up and share proposals. So if you're going to be able to, and it's not just you see a headline around, oh, this company's doing 4-day work week, I'm going to go show my boss this, but really digging into that return on investment, to Dan's point, and being able to speak that same language around trust. If you don't have that foundation already in your workplace where your team can share ideas, even ideas that are going to fail, it's difficult, I think, for anyone to be an advocate if that's the environment that they're working in.
Awesome. Thanks, Bobby. Yeah, we do want psychologically safe workplaces where people feel like they can speak up for a variety of things, right? Safety included. If you see something going on in the workplace that's unsafe, the hope is you work at a workplace where you feel comfortable speaking up. And that translates into a variety of domains about what you feel comfortable speaking up about. Reed, did you want to add something from the toolkit or other lived experience on how to advocate with the Total Worker Health Committee or other places on how to advocate for more family friendly policies, practices, and programs?
Yeah, thanks. Bobby, I really loved what you were just saying about having that culture where employees are asked about what they need in terms of family friendly and have opportunities to give input. So I was on a total worker subcommittee, family friendly subcommittee, and we redid our lactation room. And at an individual level, I was like, it'd be great to just like offer tours to other parents so they can kind of, be familiar with that space before the stress of like coming back to work after being on leave and trying to figure that all out. And so it started with a really small idea, and I feel like our HR was happy to have employee input and employee engagement in how to make the workplace more family friendly. And so it started as I could just give some tours of the lactation room actually evolved into a new parent peer connection program where I now have multiple peer parents. And when employees go to HR at their 7th month of pregnancy, or if they're adopting or fostering a child, and they can submit a request to meet with a parent, a peer parent, to go over not just the lactation rooms. We recognize, people have different feeding choices, but all the resources available at our department. We have a Google space where parents can just like share advice and resources together. We have a whole list that I and other experts at the department helped and HR helped curate in terms of like mental health resources and lactation resources and childcare resources and where to get benefits and all of those things on our internal intranet. So that has been really helpful. And then we ended up, there was so much chatter amongst parents that we developed a once a year event where we do a child item swap, where everyone comes and brings their old clothes and toys and things from kids, and we swap and then donate the rest to charity. So there's really like individual ways to advocate, to ask HR to be a part of, and then to also think about systems change. So I heard from some of the peers that I was supporting, expecting parents that I was supporting some needs around different family leave policies. And so then HR was able to say, okay, let's go to the supervisor group and really train managers to make sure they understand these, right? So like, how do we also think about training our managers, the supervisors that these employees interact with as well? So if you have any leverage there with managers, I think that's also a great route.
Great. Thanks, Reed. We're going to go opposite order and keep our responses brief for this next question. I do want to mention one thing that came up because it's been mentioned a few times, which is this concept of return on investment, or ROI. There will be ROI benefits to some of the things that you implement related to family friendly. Now, a swap of children's gear is not going to be something that has an ROI. That's more like, what is it as part of the value of our organization? And I often encourage employers and employees to think more about value on investment, or VOI. And if you haven't heard about VOI, I encourage you to look it up a little bit. Supporting lactation accommodation, it's hard to translate exactly what the return on investment is. We've tried. There are some studies that'll be able to do it. However, if you're a workplace that wants to support women's professional development, or all parents' professional development, having lactation accommodation that is useful and well equipped is going to benefit your company in the long run. And it's usually tied into the value of your company, the organizational values. And so if you want to do actuarials and numbers and go the ROI route, we have a little bit of help and resources for you. If you want to try and attach some of these recommendations to the company values that you have, that might be an easier conversation to have. I want to remind folks that the survey to receive continuing education credits is going to come in a follow-up email. It is not going to come automatically as you leave today's webinar. Let's go to this next question. Again, we'll go somewhat rapidly around the other way, which is, we've heard this a lot. I'm a person who doesn't have children. I'm not in a caregiving role. Why and how should family-friendly workplaces be relevant to me? I can't tell you how many times I got this question back in 2017, 2018. Off the top of my head, FMLA is used more for someone's own injuries, illnesses than any caregiver, right? So that's the reason why FMLA exists, is to protect you individually, your health and safety. Reed, do you have anything you want to comment on related to an individual who's not a caregiver, recognizing that we are pretty short on time?
I love this question. Yes, broad definition of family. I think we should have more inclusive language. I'm curious what other folks thinks that language should be. Maybe people friendly. I don't know. But I was going to say something very similar, is that like the Colorado family paid leave, actually the people that access it the most access it for their personal medical leave. So these benefits are really for everyone. In the toolkit, there's talk about career advancement, volunteer leave to engage with the community, and other strategies, elder care, pet care, all of those things. So yeah, thanks for the call out, though. I think it's important to name. And I know HealthLinks has an assessment if you want to figure out what your employees really value.
Thanks, Reed. You're right. We got a lot of comments about pet care, plant care. Families look all sorts of different ways, and supporting you and supporting your own health and others, really important. With that, I'm going to remind folks that this is the first in a 6-part series on HealthLinks webinars. And our next one is on Monday, April 20th. It's on 420 for those of you that are familiar with that. And it's specifically about cannabis in the workplace and how cannabis impacts impairment, what employers and employees need to know. So this is the second time we've had this conversation on April 20th. We don't normally do Monday webinars, but we thought it was important specifically on April 20th to have a conversation about something that's really impacting workers in Colorado and around the country and continuing to grow. You will get a link to register for this webinar as you exit today's presentation, and stay tuned for the survey. I want to again thank you so much to Reed, Bobby, and Dan for participating and sharing your stories today. We hear in chat how important and pertinent of a conversation this is. Stay tuned for the follow-up emails. Stay tuned for the toolkit release that's coming out. There's a lot of work going on Family Friendly. If you want to take a deeper dive, HealthLinks is here for you on assessing your family-friendly policies and practices. We're here to have conversations and help you figure out what the next steps are. I wish everyone a lovely day and afternoon. Thanks. And again, thanks to our speakers today. Great kickoff to 2026. Thanks, everyone.